Hello, my name is Francesca Ferrari, and this presentation is about mycotoxins. The goal of this project is to further research mycotoxins in relation to patient health, establish relationships with fellow TCM colleagues and physicians who have interest in learning about mycotoxins, and create new simplified education material for patients. Many people are unaware of mycotoxins, including physicians. Therefore, patient population suffering from mycotoxins can remain undiagnosed and unwell for years until an accurate diagnosis is made. My goal is to research, distill scientific medical information, and educate both medical practitioners and potential new patients about mycotoxins, their hidden sources, and how their toxicity can present in the patient population. Research on mycotoxins has been fun and interesting. Mycotoxin research is a vast topic, ranging from water damaged buildings, contaminated wheat, grains, dried fruits, nuts, etc. However, mycotoxin research goes deeper. Billions of dollars are spent by large corporations to study how to stop or block mycotoxins in the food storage and production facilities. This really is an entirely different topic. The biggest challenge that I tend to delve into scientific research that even MDs are not aware. Thus, it gets too complicated to apply in clinical practice. Therefore, it will require more work for me to distill the information to bring it to a practical clinical level. So I need to develop more wording or key topics. How or why does it matter to a patient or a potential patient as well as physicians? So this leads us to, what are mycotoxins? Mycotoxins are fungal secondary metabolites identified in a variety of agricultural commodities and water-damaged indoor environments. Mycotoxins are a group of approximately 400 toxic secondary metabolites produced by various fungi, including Aspergillus, Penicillium, and Fusarium. Water-damaged buildings are one known source of mycotoxins. Bloom et al. Research states that we show that molds growing on a range of different materials indoors in water-damaged buildings generally produce mycotoxins, and mycotoxin-containing particles in mold-contaminated environments may settle on surfaces above floor level. The World Health Organization has stated approximately 20% of the world grain supply is contaminated with some form of mycotoxins. To date, mycotoxins are known to enter a human host and can do this via the lungs, the skin, and the gastrointestinal tract. Mycotoxin presence in the food chain can emanate from contaminated animal feed in animal husbandry, contaminated wheat, grains, spices, dried fruit, nuts, pet food, to name a few. Mycotoxins are of high concern for human health due to their properties to induce severe toxicity and effects even at low dose levels. Common food sources of mycotoxins include whole grains, corn, wheat, rice, sorghum, nuts, Brazil nuts, pistachios, hazelnuts, walnuts, fruits, especially if there are something like rotting apples, they could get into the apple juice sourced from the rotting apples, or grapes, grape juice sourced from rotting grapes, even paprika, raisins, currants, dried figs, other dried fruits. All of these, especially with the improper food storage, can lead to mycotoxins. Mycotoxins have a variety of risks to human health. They're neurotoxic. They create an impairment on the epithelial lining barrier. Some mycotoxins are even carcinogenic. They can enter the blood system, and they initiate inflammatory processes. TCM organs involved with mycotoxins. Since mycotoxins can become systemic, the primary organs in TCM that can be involved are lungs, large intestine, heart, small intestine, liver, gallbladder, spleen, kidneys, and extraordinary organs, the blood vessels, bones, bone marrow, brain, and gallbladder. Here's one TCM case study I'd like to share to exemplify how mycotoxins can be not diagnosed or misdiagnosed, and patients suffer for years without getting accurate diagnosis. In this case, it's a 48-year-old male triathlete who is the patient. He's an attorney, and his chief complaint was sinus infection for 2 years, as well as fatigue. His history: he had caught a cold while training in Hawaii, and when he came back, his MD prescribed a round of antibiotics. Ultimately, the MD prescribed 5 rounds of antibiotics over a 2-year period, resulting only in minimal improvements. Then the patient's sinus infection got worse, continued with green nasal discharge, his fatigue increased, and other side effects continued. The patient was then diagnosed with asthma and given steroids. The patient was then unable to run and cycle. At the first office visit, I advised the patient that sinus infections are not exclusively bacterial. They can be viral, fungal, or mycotoxins. At the same time, I instructed the patient to return to his MD and request a nasal sample to identify the source of the infection. I promised if his MD declined, I will refer him to an ear, nose, and throat specialist who will. As a part of the diagnosis and further treatment protocol, on the first office visit, I also advise the patient, regardless of the type of sinus infection he has, 1 or 2 glasses of wine and eating dessert every night will feed whatever infection he is battling. I counseled him to eschew alcohol and desserts for 1 week and return for a follow-up. The MD did not take a nasal sample, so I referred the patient to an MD who did. The lab result: heavy mycotoxin overgrowth. So this patient suffered for 2 years without getting an accurate diagnosis. The patient continued with weekly acupuncture and customized dietary protocol. On his own volition, he stopped the asthma medication, was able to sleep deeply without pillow support. Sinus infection improved in stages from green to yellow to white to resolution. The patient gradually began to run several times per week and cycle over 75 miles per week again. A detailed intake and mycotoxin awareness is important to catch any sort of infections that have been overlooked. The intake should include notes and ask what, when, where, how, other physicians who were involved, medications and when starting the medications, lab reviews, when does the patient feel better, when does the patient feel worse, what makes the patient feel better, what makes the patient feel worse, history of antibiotic use, history of water-damaged workplace or home, and dietary analysis. Of course, we look at the tongue and pulses, we inspect the skin. With skin, there can be red rashes and other dryness or chafing. We look at the facial pallor, we inspect the eyes and the sclera, and also provide a detailed initial intake questionnaire. The action plan includes already starting research on mycotoxins, continuing to develop bibliography and research, which I really like doing, contact the MD who has worked with me before on doing Zooms and writing papers to see if he will be my Zoom manager, draft a simple info on how mycotoxins might be relevant for patients, set a date for a telemedicine Zoom conference, draft outline of mycotoxin topics, sources, symptoms, TCM, biomedicine case studies, develop a list of MDs, osteopaths, acupuncturists, patients to invite, target range for attendees 20 to 30 people, complete PowerPoint for the telemedicine Zoom, update relatable info on a new website about mycotoxins and their relevance, have an MD and one patient review the PowerPoint for constructive criticisms, make any necessary edits to the PowerPoint or the points of interest, send invite to above mentioned list, launch telemedicine Zoom. Assessment of action plan. Concrete results are my way of assessing progress. I do best with handwritten lists as more of my chi goes into writing. I write short, medium, long-term lists and love to cross them off when I get something done. My work schedule with clinic, doctoral, and several other big professional projects are all in motion and moving forward. Especially with COVID-19, however, numerous quick pivots have been required, including shifts in travel plans and research and protocols for COVID-19. So it feels wisest to have goals, move forward with them step by step, while also being prepared to be able to be flexible with due dates on projects that can be shifted, such as this. Thus, depending on the workload that our third semester, tri-semester brings, I want to move forward with the process of integration with other medical practitioners, patients, and potential new patients, with some flexibility for the deadline. Thoughts on integration process. I've already noticed how well my fellow colleagues have done with their presentations, and by viewing and listening have reflected that my project topic, mycotoxins, is quite broad in contrast to succinct focused action plans others provided. There remains room for improvement, such as how to make the specialization of mycotoxins relevant to patients, new patients, and medical practitioners. Why should they care or be interested? How to use appropriate vernacular and simplify for lay people and patients to understand mycotoxins and their harmful effects. I've not done a PowerPoint in a while, and I also liked my classmates' use of different backgrounds, and I did not have time to explore how to find other choices. Any feedback on that would be greatly appreciated. Feedback from another project that we did in this class, where I immediately mailed and reached out to a local MD, was very successful, and I'm looking forward to employing this project as well for reaching out to the community and integrating our work. Thank you, everyone. All feedback is welcomed.